I'm Dr. Maria Martinez from Puerto Rico, and today I will be presenting the impact of Hurricanes Irma and Maria on diabetes incidence and management. People with diabetes have serious complications during disaster as a result of disrupted health services and limited resources. Anxiety, disruption of water supply, medication, and access to nutritious food after natural disaster could lead to an increase in glucose levels. In 2017, Hurricanes Irma and Maria impacted Puerto Rico, leaving many without power and water for more than 6 months. During this period, primary healthcare services were disrupted as a consequence of limited power, water, and other resources. In Puerto Rico, the prevalence of diabetes was 60% for 2018, according to the Behavioral Risk Factor Surveillance System, and it was the third cause of death in 2017. This study prospectively evaluated the impact of Hurricane Irma and Maria on diabetes incidence and management in Puerto Rico and the role of preparedness to help reduce the health impact of future disaster in high-risk population. To our knowledge, no prior study has assessed the impact of Hurricanes Irma and Maria on the changes in glucose levels. Analyzing these two cohorts will provide preliminary data on how those changes affect Puerto Rican population under natural disaster. This may allow public health specialists to strengthen the guidelines of preparedness for future natural disasters. Participants from the San Juan Overweight Adults Longitudinal Study, aged 40 to 60 years and free of diabetes appearance, who complete a 3-year follow-up visit, were recruited for the Preparedness to Reduce Exposure and Disease Post-hurricanes and Augment Resilience study. A total of 358 participants completed prepared visits 1.7 to 2.5 years after the hurricane. Self-reported physician diagnosed diabetes was reported, and glycosylated hemoglobin, fasting glucose, and insulin were assessed at all 3 visits. A total of 125 patients with diabetes were recruited from a federally qualified health center called COSSMA. These participants were interviewed and glycosylated hemoglobin were abstracted from their medical records. We compared glycosylated hemoglobin, homeostatic motor assessment of insulin resistance, fasting glucose, and diabetes status before and after the hurricanes, and changes in this measure between the follow-up period prior to and spanning the hurricane. Among SOALS participants, 7% of them developed diabetes in the pre-hurricane period compared to 13% post-hurricane. After adjusting for age and body mass index, diabetes incidence was 2 times higher after the hurricanes than before. Glycosylated hemoglobin levels increased significantly in the post-hurricane visit compared to pre-hurricane as seen in Figure 1. Higher changes in homeostatic motor assessment on insulin resistance and glycosylated hemoglobin between visits were seen spanning the hurricanes compared to before. Among COSSMA participants, glycosylated hemoglobin levels were similar before and after the hurricane, as seen in Figure 2. Slightly more participants had controlled diabetes after the hurricane compared to before. However, 50% of them reported trouble getting medical care for diabetes or related complications, and 30% had problems getting or storing insulin. Our result led to the conclusion that the incidence of diabetes may have increased in Puerto Rico following Hurricanes Irma and Maria. Among participants without diabetes, an increase in glycosylated hemoglobin was significantly higher post-hurricane than pre-hurricane. Also, changes in homeostatic motor assessment of insulin resistance after the hurricane were significantly higher than pre-hurricane visit. Participants with diabetes faced challenges assessing medication and healthcare after the hurricane, but this did not result in a significant increase in glycosylated hemoglobin nor in uncontrolled diabetes. These findings have a high public health relevance as high-risk adults and people with prediabetes should take additional preparedness measures upon threat of natural disaster to maintain healthy levels of glycosylated hemoglobin. Thank you for listening.